The three main types of individuals that I see can generally be broken down into three groups, which will have some overlap sometimes. But generally, it is folks that are struggling with eating disorders, athletes, and individuals that are facing a life-changing, life-altering diagnosis or condition. For example, people that are facing a cancer diagnosis, or someone that's been diagnosed with diabetes or a heart condition. And what all three of those groups will have in common is that all of them are facing a medical or physical condition that we're trying to improve by learning really specific mental skills. So whether you're an athlete that's trying to improve your golf swing, or you're someone that's really hoping to face their cancer diagnosis with resilience and strength, there's a lot of overlap in the skills that those two general types of individuals will need. What will happen at your first appointment is that for the first few minutes, we will talk about consent for treatment. And the highlights of that conversation are what types of information I can and cannot keep private. And we'll talk very specifically about what exceptions to your privacy exist. But you'll also find out how, if you want me to share your information with anybody, what that will look like. And that generally doesn't take longer than 10, 15 minutes. And then after that, what we'll do is really get to know each other, because I need to know what is going on in your life and what you are happy with in your life and what you are wanting to change. And after that, we'll come up with some really specific ideas about how you want to change your life, what you want your life to look like, and again, very specific steps that will follow to get you there. I always want for people to have a really clear idea when they leave that in 6 months from now, this is what I want my life to look like. And when I look back, these are the steps that I took to get to the point where I am now. For the most part, when people are starting out in therapy, generally we're meeting once a week. That does not last forever. As I like to tell people, the whole point of therapy is to need less therapy. So if you're coming in once a week for a while and you feel like your life is improving in the way that you want it to, you've got your feet under you, you've got some specific skills that you can use between appointments, we'll start to space them out a little bit, drop down to every other week and see how that goes. And if you continue to feel that you are moving in the right direction, we'll drop that down until you get to the point where you are not needing regular therapy, where we have a relationship a lot like with your primary care doctor, where you're not going in once a week, but you have a relationship with your primary care doctor that allows you to go back if you feel that is necessary. Absolutely not. It means that you are recognizing that there are things in your life that you want to be different and that you're willing to take the steps necessary to make it different. But you are always in control of as many things in your life as possible. It really depends on what you want to change. A lot of times, most of us get involved in patterns that for one reason or another may have worked in the past, but don't necessarily work in the present or will not work in the future. So a lot of it is looking at the patterns that you find yourself engaging in day after day, week after week, month after month, and figuring out again, what works, what do we need to edit? And based on how you want your life to look differently, we can edit different aspects of those patterns in ways that make more sense today. Only if you want them to. One of the first things that we talk about in that first appointment is what that will look like. If you want your friends and family to know that you're in therapy, how we can make that happen. But unless you choose to tell them or choose to include them in therapy in some way, that's entirely up to you. Advice is something I'm not a huge fan of giving. There's a few reasons for that. Mostly, you are the person that knows yourself and your situation the best. I'm not there with you day in and day out. It's really not appropriate for me to give you specific advice. My role is more to help you make those decisions on your own in the best way possible. Normally, when people decide to make that leap into therapy, it's because they are uncomfortable enough with either an aspect of their lives or a pattern that they find themselves engaging in over and over, that they recognize that this is not working for me. I'd like to do something differently. This relationship, this behavior, this pattern of thinking, this thing I can't seem to get a hold of. Those are usually good indicators that you would benefit from therapy. One of the things that we know about the human experience is that if you are mentally, emotionally well, you are going to be better at facing whatever physical complication, syndrome, illness is thrown at you. We know that when you are able to face things like cancer treatment or an open heart surgery or anything else that can be really significantly life-changing, if you are emotionally resilient and strong, facing those things will be that much easier.